Good day and thank you for joining me. My name is Dr. Diana Njuguna. I'm a proud fellow of the 2025 Signature East Africa Leadership Journey, and I'm going to be presenting my leadership project entitled Mentoring Women Doctoral Graduates in Health Sciences. So I am a lecturer and a chair of the Medical Surgical Nursing Department in the School of Nursing at the Matthew University of Technology in Nyeri. I'm a nurse educator as well as an oncology researcher, and my research is focused on cancer care and nursing education. I'm very passionate about cervical cancer prevention and advancing health policy through research and advocacy. The problem is significant, whereby we have profound mentorship gaps that are faced by women PhD graduates in health sciences in Kenya, and this is during their transition from the studies to the career phase. And the goal of this, the purpose of this project is to be able to implement a collaborative virtual mentorship exchange program where women are able to interact and learn from each other and also get the tools that are going to help them navigate this phase. So our vision is very clear: to provide structured mentorship via virtual platform where women are going to come together and they are going to be able to overcome the systemic barriers that they are facing at the moment, because you find these women are normally on their own, trying to navigate on their own. Hence, if somebody would hold their hand and try and show them the direction, I think we would have great leaders in Africa. The purpose of this project is empowerment of women researchers as well as women who are advancing their careers to be able to navigate through this process. And we know that the traditional mentorship models have not been working, because we find that many women who are in the low middle income countries normally do not have these scalable structures that are able to support them during this phase as compared to our counterparts in the in the Western world. So our approach basically is we came up with a pilot project whereby we're able to get attract 30 women from 7 African countries, PhD in health sciences graduates, and bring together 6 qualified mentors, and we were able to generate a mentorship framework. And the key components of our project have been, we conducted an orientation session on 19th of January, and we have been able to do 3 other virtual workshops on professional transition, leadership, and even research funding. So what we noted is that the need is there, it is very real. And as you can see, the call for application, we were able to attract several women, and this was the introduction of the project. So the peers are able to get support from each other even as we progress with the project. We've been able to have successful group mentorship sessions with very high attendance and even a very high engagement. And we've been able to even get some feedback that is going to be used to inform our final report on the findings. So we envision that there's going to be seamless transition during this phase, increased research output, as well as independent academic careers for women, and even sustainable mentorship. So we are hoping that this initiative is going to really impact and bring that change that we really seek for. So I have been able to exercise authentic, strategic, and impactful leadership. I've been able to foster trust and even welcome diversity in terms of the women that we've been dealing with, and even engage, with the stakeholders very well because of the skills that I've been able to learn of being an adaptive leader. So to be able to continue with this sustainable culture of mentorship, we need your help. We are calling you to be able to plug in. And in case you would wish to have a further conversation with me, you can reach me out on these contacts. We can be able to discuss further on how you can plug in as a mentor, as a partner, so that we can be able to ensure that this initiative is sustainable. Thank you so much for joining me.